So next up, heavy metals. So all these symptoms, headaches, fatigue, neuropathies, so once again, numbness and tingling, or nerve pain, muscle pain, joint pain, brain fog, memory loss, anosmia or loss of smell, depression, high blood pressure, history of mercury, silver fillings in the mouth, either they're still in the mouth or even if they've since been removed, and then a history of playing with mercury as a child. So for me, I had a lot of muscle pain which went away when I started getting rid of my mercury. So the laboratory test to do is the doctor's data toxic metals urine test, and we provoke it with DMSA, which is a very big sulfur compound that pulls the heavy metals out of the tissues into the bloodstream so that they can be collected in the urine for the next 6 hours. And the way to provoke it is 10 milligrams of the DMSA per pound of body weight. So a 150-pound person will need 1,500 milligrams of DMSA. And then laboratory data. So heavy metals excreted in urine with a DMSA provocation that is 10 times the baseline levels or elevated by laboratory values. And so basically if it shows up as being yellow or red on the laboratory value, that's considered significant, or 10 times a pre-provocation. So most of the time it really depends. If we presume heavy metals and for some reason we get a normal test, we may want to do a pre-test to double check it, because if the pre-test is like 0.1 and the post-test or the test after provocating with DMSA is 1 is not going to show up as positive. It'll show up in the green, meaning that it's normal. But the fact that it's 10 times the pre-test makes it significant. So that's where doing 2 of these tests would come in handy. Education. In my experience, it is very likely that someone has heavy metal toxicity if they have 2 or more of the above symptoms and the elevations on urine laboratory testing. And then conclusion section, make your determination. Yes or no.